In my last video, I discussed how carpal tunnel syndrome is diagnosed in a hand surgeon's office, but some of you may be interested in taking your own best shot from home. A very cool study done in 2008 shows us how we might predict carpal tunnel syndrome with just 6 signs and symptoms. You just add up your score, and if it's greater than 12, it's likely, though not guaranteed, that you have carpal tunnel syndrome. This is a scoring system that we call the CTS-6. So let's get to it. Sign number 1, symptoms primarily in the median nerve distribution. That means that you feel numbness, tingling, burning, or shooting pains only in the thumb, index finger, middle finger, and sometimes half of the ring finger. Definitely not the pinky finger. If this is you, score yourself 3.5 points. Sign number 2, symptoms that are primarily at night. For a variety of reasons that we don't have time for, carpal tunnel symptoms are oftentimes worse at night. If this is you, give yourself 4 points. Sign number 3 is the Phalen's test. In this test, place the backs of your hands together and hold them there for about 45 to 60 seconds. If this causes numbness and tingling in your median nerve distribution, give yourself another 5 points. Sign number 4 is the Tinel sign. In this test, you use your finger to actually tap on the nerve itself. So if you tap down the length of the median nerve in the wrist, just before it gets to the hand, you may experience a shooting pain or a tingling sensation into your thumb, index, or middle finger. If so, give yourself 4 points. Sign number 5 is Thenar atrophy, and this is the most severe. If you remember from my previous videos, the median nerve supplies the muscles at the base of the thumb. We call this group the thenar muscles. If the median nerve is pinched, thus blocking nerve input into these muscles, they will shrink or wither away. And if you can visibly see this in your hand, that's a sign of advanced carpal tunnel syndrome. Score yourself 5 points and quite honestly, get yourself to a hand surgeon ASAP. Sign number 6 is called 2-point discrimination. I do this last because it may be hard to do at home, and if your score is greater than 12, just skip this one. To do this, bend a paperclip like so and make sure that the points are 6 millimeters apart. Then close your eyes and have a friend push either 1 or 2 of those points into the fingers of the median nerve distribution. Your job is to say aloud whether you feel 1 point or 2. If you're correct each time, you have normal sensation. If you can't tell, then you have decreased median nerve sensation, and you should score yourself 4.5 points. And that's it. Time to add up your 6 scores. If your score is greater than 12, you're likely, again, not guaranteed, to have carpal tunnel syndrome. And if it's under 12, you may have something else going on that should have some further testing. And that's it. That's a basic understanding of the CTS-6 score for detecting carpal tunnel syndrome. As always, remember to check out my other videos to learn more about carpal tunnel or other conditions of the hand and upper extremity.